a presentation that I've actually been quite looking forward to. I got to meet Julian at an economics workshop at Nuffield College at the beginning of the academic year, and we really got engaged in an exciting conversation. And I can't wait to see what he's developed since and how it's received by all of you. All right, Julian, thank you. Over to you.
And thanks very much for inviting me. It's really, really great to be here. I feel a little bit out of place with so many people who know a lot more about well-being than I do, but it's perfect time. I'll try to situate it in a slightly broader context as well, a research agenda I've been working on. And obviously feedback would be wonderful. We're still doing data analysis on the main project I'm going to present to you, and so finding out what people think is interesting and maybe some interpretation there for writing that up, but I'm hoping to do more data collection as well. So input would be really wonderful. I'm at the Global Priorities Institute, which is here at Oxford, which is a mix of basically philosophers and economists thinking about how to do the most good in the world. So that's our question. Okay, let's see if this works. All right, so I'll actually just put all of these questions up. This is for the overall agenda on. There's one more. Empirical facts about normative value. So I spent some time at the World Bank, and actually I'm going to present a version of this in about 10 days at the World Bank as well. So curious to get their feedback. And so really thinking a bit about the policy side as well. So these are supposed to be questions for which there's no sort of objectively correct answer, but they matter normatively and they are very policy relevant. So deaths at different ages, I've been thinking about that. I'll present very briefly some evidence from a paper I published a few years ago about deaths at different ages. That came up a lot during COVID, but obviously an important question for lots of reasons. We're thinking about different interventions. Deaths in the future, this is something GPI thinks about a fair amount, is long-termism and the far future, population ethics, things along those lines. Non-existence, I'll talk about that a bit as well, in addition to death. One can imagine non-humans, whether that's animals or AI or aliens or anybody, however far out you want to go on that. Coming back a little bit more concretely, and in the back of your mind, really sort of ideally be thinking of policy interventions for this, whether that's governments or the World Bank or NGOs or philanthropists or somebody else. That's, in some sense, that's the audience, that's the motivating audience here. So imagine an intervention that causes people on average to live 5 years longer, or a different intervention that costs the same, where people would earn 11% higher lifetime income. If you're wondering why I chose 11%, it's because in developed countries, those are the gender differences. So women live 5 years longer, men, after you control for observables, earn 11% more. So would you rather be born man or woman? That's the question here, in some sense. Other things that go into that. So there's no right answer here, right? And GiveWell and others have thought about these kinds of things. And they matter a lot in policy. But you could add other things. It could be mental health, obviously, in addition to physical health. It could be human rights or autonomy, living in a democracy. So how do we trade these things off? And having spent time, actually, before I was at the World Bank, I was in the US government for a while at the Consumer Financial Protection Bureau, so a financial regulatory agency. And so I sort of had this model, this broad model of you have ministries or agencies that work on jobs, that work on education, that work on health, and they're each trying to optimize in their space, ideally, and that's already hard enough. But then go one level up, and it becomes even much harder to trade those things off, and there's a little bit less of a setup for that. Economists and social scientists in particular don't tend to focus on that as much, and that's of course where we're going to get into maybe the idea of well-being and well-being. So, oops, wrong way. So typically economists, I mean, this is my training as an economist, and I'm going to make this sort of completely broad, but I think it's fair to say that there's descriptive economics, which says about how the world is. There's normative economics, but in economics that really is almost always a conditional statement. So if you're trying to maximize profits, here's what to do. If you're trying to maximize the utility function, here's what to do. If you're trying to maximize a given social welfare function, here's what you should do. But not so much what should utility function be, what should the social welfare function be. And there's good reasons for that. I mean, economists shouldn't be coming in, or no, anybody else shouldn't be coming in and saying, here's what to do. But I do think actually we have some things to say there. And the other question is, is it philosophers and bioethicists? Is it politicians or decision makers? Which I said, I've tried to keep it policy relevant in the motivating examples. Who's doing it? What's the framework for doing that? And so that's the background for where I'm approaching well-being from. Okay, so I think we have some tools. I'm going to talk about the last bullet point here, data collection and preference elicitation techniques. A lot of people here have thought more about that in the context of well-being than I have, but imagine the broader agenda as well. But also tools from evolutionary psychology, tools from welfare theory and decision theory, tools from normative philosophy, and trying to put those together. So that's where I'm trying to go hopefully for the next few years. Okay, so one caveat just to say to sort of preempt a potential criticism is I'm not going to go and ask people, here's a number, here's a parameter, here's a well-being value or a discount function value, which is another good example of this sort of agenda, and just plug it into a social welfare function. But I still think there are things that it can say even without necessarily plugging something in directly. And that's one example that I'll give before getting to the main well-being ones. So what are the other kinds of things it can do? I think it can put some bounds on what's reasonable versus not. It sort of can narrow down the range that we look at. It can maybe tell you something about correlations or directionality of effects. If you have this intervention, what's going to happen? Which way is it going to go? Is it correlated with different demographic characteristics? You can think of survey experiments where you have debiasing interventions, virtual reality, and playing around with some of those now to try to get, there's no gold standard here, there's no objectively right answer. How do we know if we're converging on the right answer? Well, maybe we can get some of that more from first principles. I can give some examples or during the discussion, happy to talk about that more if people are curious. The other thing I would say, and this is maybe some discussions with some of the philosophers and others where, because the example, the data I'm going to give is from some representative samples, online surveys, so not sophisticated thought processes, not a lot of deliberation going in, but roughly speaking, I think there's still a lot of potential value from that. So I think there's still a lot of time that we can collect, equivalent to say an expert spending a few years on this. And I think having the broad sample of inputs, again, can tell us something about what's reasonable or not. So if it confirms where we already were as, I won't speak for myself, but as the experts in the room, as the different people who've thought about this a lot and written about it, if we end up in a similar direction by going out and asking people, then that's a good sign. If we end up in a different direction, they tell us something completely different, that doesn't mean they're right and we're wrong, or vice versa, but maybe it says we should think more about those ones or figure out where the discrepancy is coming in. Okay, so a couple of examples to think of that I won't talk about. Pure time preferences, maybe this is a natural one. A discount rate, there's interest rates, but as a just sort of discount rate on the future, a pure time preference, that's, I would say, a normative value. Clearly policy relevant. People have thought a lot about that. People have done lots of different empirical estimation exercises, either from microeconometric data or from surveys or from elsewhere, lab experiments. So that's the kind of thing, but I want to apply that in different settings. And then DALY's disability adjusted life years and quality adjusted life years. Now, I'm sure probably everybody here is familiar with the idea of, I don't know which one you all prefer, but Wally's, Welby's. Welby's, yeah, okay, so we'll go with Welby's. So DALY's I've worked on a little bit with actually my father, who's done a lot on that with the World Bank. But trying to expand that on so you can see that as part of the agenda, going from the health setting to a broader setting so we can compare interventions in particular. Okay, so briefly, before we get to the well-being data, this is the kind of thing where I think it's a different setting and I think it can tell us something qualitatively interesting, not just quantitatively. So, sorry, it's a bit of a morbid concept, but think about stillbirths. So this is basically fetal loss in the 3rd trimester of pregnancy. I won't say death, technically it's not a death, it's a stillbirth. That's one of the things that comes into the global burden statistics. Early neonatal deaths, so that's the first 7 days after birth. So this is large numbers, 3 million of each, so 3 million stillbirths roughly every year, 3 million early neonatal deaths globally. This is huge numbers. And actually, I think about a third of the stillbirths from my co-authors who are experts on this, are neonatologists, a third of the stillbirths are in the last 12 to 24 hours, so right before birth. So really in the complete viability. So in current statistics, these aren't lives, so these aren't deaths, so they're not reported in death statistics. So stillbirths don't appear in any death statistics out there. So should we, and in DALYs, there's zero loss in DALYs. So there's no DALY loss for a stillbirth. So if you look at the sort of DALYs as a function of age, for death as a function of regular age, it's a flat line, and then it jumps up discontinuously at birth to around 31, 32, and then goes, because there's discounting and other things, so it's life years lost. So this is kind of odd to have, potentially odd to have this huge discontinuity at birth. And in particular odd because if you go out and ask anybody, so people on the street, parents or potential parents, bioethicists, doctors, public health researchers, there's nobody I've ever met who says we shouldn't put resources into avoiding stillbirths. So everybody seems to count a stillbirth as a loss, and therefore some resources should go into it. But that's not there, that's not in DALYs, there's zero loss. So if you took the DALYs seriously to do cost effectiveness interventions and analysis, you would say we shouldn't put any resources. Okay, so what should we do? How should we count? One idea, so this was really proof of concept. This one was on Mechanical Turk, online, not representative sample. I just wanted to ask people to see what would happen. So program A saves 100 adult women, so that's our numeraire, our point of comparison. Program B saves X, let's say infants in the first week of life, but I also did it for stillbirths, so I'll show the other one. So we vary that, and we ask people what X would make you indifferent if these two interventions cost the same. Okay? Some people refuse to answer, that's fine. Some people just say 100, that's fine. Some people give numbers. Are those numbers reasonable, and what do they tell us? So I'm skipping through this part quickly. This is the different ages, so this is the X of what, and so the green bar is the 1 week old infants. The, purplish bar just to the left, this is 159, is 39 week old fetuses, so this is the week before birth. Now, it actually goes non-monotonically. This is my attempt to prove it's real data, because if I was making up the data, I wouldn't have done that, because that doesn't make sense. Unless I wanted to say this, it'd be really sophisticated. So, but roughly you want to think of those as about the same. And everything goes roughly in the right order. So you can look at the other ones if you want. That's one year old children, and then it's mothers, pregnant mothers. Remember, 100 is the adult women is the numeraire. So the pregnant mothers are below 100 because there's the loss of the mother and the fetus. So, but concentrate on the second and third bars, so this is right before and right after birth, 1 week before and 1 week after, it's roughly the same. So that was surprising. So that suggests not just 0 to 30, but there's no discontinuity, which to me personally, I'd actually written a theoretical paper with my father suggesting something like that. That seems reasonable to me. I was surprised that that's what people would say. So this was all against versus 100 adult women. I thought maybe if I do it directly 1 week before and 1 week after, people will really see the idea of birth as salient. So I went back and collected more data, and it still worked, in the sense they gave the same answer. So this is, I said some of this already, implicitly no discontinuity at birth, check directly. So I find this doesn't prove anything, but if I was a policymaker, I would find this fairly compelling to say there are these physiological reasons, there are bioethical reasons, and now there's data. Again, my data isn't great here, I'll be the first to say, but this is the kind of thing that I think the data can tell you. Qualitatively, I wouldn't pick the particular numbers there, but the fact that it's telling me there's no discontinuity at birth seems compelling. Of course, we happen to find that here. If we found something else, we would have had to say something different. Okay, so I'll make sure we have plenty of time for discussion. Give the basic version here. So this is the main data I wanted to present that I said we're still working on and trying to do the analysis. So this was representative, or supposedly representative with our survey partner, but online of, like I said, in each country it's about 600 people. So this was Brazil, China, and the United Kingdom. So 3 different countries around the world trying to potentially get at cultural differences as well. So we asked a bunch of, as you might imagine, background sociodemographic questions, in particular including religion and belief in afterlife, which didn't turn out to be as important as we thought it might, but we wanted to check, health, education, income. And then we ask a personal well-being scale. I'm going to put that one up. I expect we'll have plenty of discussion about that, but I'll show you the exact wording in a moment. And then we had a number of other things around population ethics and determinateness, which I'm not going to talk about today, but just to say there were a few different things. It was probably a little bit too much in one survey, but we got some interesting data. Also, I'll focus on the well-being ones for today. Okay, so this is long. I'm not going to read it all out loud. You can read it, and I'm sure. So for now, I guess I would suggest we can obviously come back and have discussion of this. If there are particular questions, I'll tell you what we were trying to get at. If there are particular questions about that, happy to do that now. Then maybe I'll show you the results, and then we can come back to general thoughts on this scale, because it was a bit of a risk to go and do something ourselves, especially knowing what's out there. The idea was, this is not happiness at a moment in time. It's not supposed to be affective state. It's overall existence, so something closer to life satisfaction, but necessarily considered from a particular point in time. So we're asking people about, it's not always about themselves, but let's say about themselves. So we're asking you right now, with the information you have right now, the person you are right now, about your overall well-being or existence. So we do say well-being, personal well-being we use sometimes. And we define the endpoint 0 to 100. We don't say anything about neutrality. We'll see that's going to be important coming in. But the idea is 100 is, as you can see, the highest that's possible for a human, let's say a modern human being, so not genetically augmented, changed, cyborg, anything like that, current human being to experience, but not in a moment. This is overall lifetime. And so we just put a bunch of, debating whether to put in particular adjectives, and I know people here have thought a lot more about this than I have. We decided we should put some in to give people a sense of that, trying not to pin it down too much, and 0 is at the bottom end, so the lowest possible. Okay, so hope you guys have been reading as well. I'll pause for a moment in case there are particular questions about that.
Source, or is this self-made?
Self-made, so
Interesting.
a bit risky and harder to compare with other things. And I'm happy to. I don't feel super strongly about that. We had an idea of what we were trying to get at, so tried to do that as well as possible. But and then of course there was the translation into Brazilian Portuguese and Chinese, which adds to it. But I'm happy to be convinced that we should just go with one of the standard scales as well. But I wanted to try this.
Why did you not go with one of the standard scales? What was the reasons?
Well, I suppose it was that we were. I mean, it's a good question, and I don't certainly don't have anything against the standard scales or a particular reason for this. It was this in between, I think, of thinking. I suppose how do I put it? This mix, which I think is a bit hard to get at, and we struggled with even conceptually for ourselves, of wanting to get at overall life satisfaction, but from a point in time. And I thought I decided that was the most reasonable from a policy perspective. So the motivating aspect is this, what should we be doing when we're thinking about interventions? And I wasn't sure that any of the standard scales got at that as well.
Julian, if I may though, if I ask you about your life satisfaction now, at this particular point in time, and I ask you again a year from now, it may not be the same answer.
Mm-hmm.
So implicit in the response to why you're not taking the life satisfaction scale, you seem to be assuming that it is stable, perfectly stable over time. And not relevant to a particular point in time, but it is.
It is, but I guess my worry would have more have been, but I'm happy to do things otherwise, that it doesn't necessarily take the future into account, the expected future in a life satisfaction scale. I don't know whether you would imagine it does, or whether you think that people interpret it that way.
Does this take the expected future into account?
Well, I don't know whether it does, and we had a little bit more around it, but that was our goal, was it really should be. What we're trying to look at was best sense of overall life.
I think there is an empirical answer to you trying a new question, which is, could you have integrated the standard life satisfaction or a Cantor ladder of life in the survey, or with a similar group of people? So randomly assign your new well-being measure with a very standard, with a typical one, to see the extent to which it gives you the same results or not.
Yes, and
Or ask everyone to vote.
And I'm trying to remember, because we did ask a few questions at the end that were more standard, and I don't think we asked that one because we thought it was too close. I mean, we should have. I should know. I should check. But we did ask a few more standard ones, certainly about physical health and some other things at the end. But yeah. All right. So this is the questions we asked people about from that scale, and then, well, yeah. So this is basically the ones I'm going to talk about. I'll put the numbers up obviously in a second. So we asked people, what do you think is the highest in human history that anybody has experienced on that scale? Okay. Now, in theory, everybody should give the same answer for that. I mean, they might have limited information, but there is some sense of what that number is. So one reason we did it this way is then we can, to some extent, calibrate individual scales by saying for the highest and lowest in human history. So we can either report the numbers as the absolute level, or we can calibrate according to everybody's own sense of what they report as the highest and lowest in human history and scale everything relative to that. Average across everybody in the world yesterday. Highest ever for yourself, lowest ever for yourself, you, yesterday, now, your average across the previous year. I won't focus as much on those. And then being dead on that same scale and non-existence on the same scale. And I'll show you an intervention-based version of those questions because, of course, it's quite weird to ask what's the experienced well-being of being dead or not existing. But there's a more well-defined version of that question. And as I suspect everyone here knows, those are super important for the policy version of well-beings and neutral points, and if you want to compare interventions, which is what we do. Just write a note. Okay, so you have a moment to think what you think the numbers are, except for Michael, who's seen it already, and anybody else. And where you would put yourself. I was asking somebody, actually just today, who asked what I was talking about, what I was going to be at a seminar about, and I asked her for herself, and she said 90. Wow, I said, that sounds great. Good for you. But maybe the people here are 90s. I think that would be in the 80s, maybe. Okay, so these are just raw averages. Obviously, we can do other things. We can medians, we can do other things. Raw averages across everybody. A lot of people.
Is the population a normal distribution?
The responses?
Yeah, would you think about the average across everyone as being about 50? You know, if you think.
Well, so we didn't want to pin down where the middle point should be, whether that's either the average or a neutral point. So we didn't want to say anything about 50. And of course, one of the questions here is, are they interpreting it as a linear scale thing? So no, it is fairly normal, if I remember correctly, but it's not centered at 50 or the other ones. All right, so here's the next few. So you see for yesterday for yourself, that's the average across individual respondents for themselves. And then for the previous year, average across what they think is the average across everyone in the world yesterday. So all of those are kind of mid-50s as an average. Close to 50, which might be a bad sign, might be that a lot of people are implicitly assuming 50 is the kind of central point of the scale, which is, I didn't want them to necessarily believe that, but maybe they do think that's where it is. All right.
Your lowest ever is 23. Also being dead is 23.
Yeah. Well, if you've ever considered
Yeah.
not going on with life, then yeah.
You could be flexible.
Yeah, so the lowest being 10, of course, a lot of people say 0, but a lot of people don't. I don't think I would for the lowest ever in human history, but it's pretty low. And then 24, which if you want to translate this to a 10-point scale, you can all do the math.
Sorry, wait, the lowest and the highest is the average of humanity at one point in time.
The highest in human history is we ask each individual respondents, what do you think is the highest any single individual has ever experienced?
How is it not 100?
Oh, I would
How
never.
could it not be 100?
I would definitely not say 100. No way. Because this is entire life satisfaction. So you think somebody has experienced a perfect life?
Yeah.
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 I don't.
There
I
are
don't.
so many people.
I know. So, but yes, that's fine. I definitely don't. And
This is for YouTube. It's better if you sort of move slow.
okay. Yes. No. And I'm getting close. There's not a lot more. So and then yes, that's a good one for discussion. Okay. So we tried a couple of different framings. It didn't end up making a huge difference. So I reported overall. So for the death, we tried a framing where we just asked directly the way the other ones. Where do you think is being dead? So we don't say, we're not trying to get the act of death. Obviously, what we care about is, although it's a strange idea, we care about is being dead, the state of being dead. Where is that on the 100-point scale? But this is the motivation for it. So we also asked this version, we randomized. We also asked this version of the question. So program A will save 100 people from being dead. If they survive, if they're saved through the program, they'll live at some average range of well-being levels. Program B saves 100 people from being reduced, they're getting sick or something happens to them. They're reduced to some well-being level of X, If they're saved, if the program avoids this calamity, they'll live at an average range of well-being levels. The two programs cost the same. What level X makes you indifferent between these two programs? So that is the policy question that we're facing that motivates it. And so that's, I think, a pretty well-defined way of saying the X that makes you indifferent to being dead, and then same thing for non-existence. So a group doesn't exist yet. If they come into existence, it'll be at some average well-being level of Y. What Y makes you indifferent, causing their existence, bringing about their existence versus not. So if you think of population ethics, if you think about fertility programs, if you think about climate disasters, things like that, this would be the relevant question. Okay, and then the last numbers are across across countries. So in terms of absolute numbers, absolute levels, this is not exactly this, but it's about right. The specifics, Brazil and UK were pretty similar. China was about 10 points higher, so this is sort of own well-being, average across the world, those kinds of things. China is saying higher. For death, UK is a bit lower, so this is the indifference point, being dead point. So for one thing that's interesting there, that China is giving 10 points higher overall, but that's not just they've moved up on the scale, they've come back down for the death one. And for non-existence, China is much higher. So it's definitely a different perspective there. And that's it. So happy to have discussion, feedback. Yeah, I just think it's good to be transparent about these assumptions and apply some of the tools we have both empirically and theoretically, and have to defend the choices in public, especially from a policy side. Yeah.
Wonderful. Thank you, Julian.